Does it hurt? Will I be awake during surgery? Will I feel it? These are some of the common questions that I get when patients come to see me and I'm evaluating them for possible cataract surgery. These are all very common questions and very common concerns. In fact, it's not unusual to feel anxious about having cataract surgery. After all, it is surgery on your eyes. Let's talk about some ways to think about anxiety when it comes to cataract surgery, or ways to think about anxiety, or some things that may help ease your worries. Number one, cataract surgery is the most commonly performed operation. A lot of people have cataract surgery every year. Number two, in general, cataract surgery does not hurt. You do not feel the surgery. There are maybe some parts where you feel some anesthetic, or you may feel some stinging or burning during the surgery, but in general, it is a comfortable operation and the post-operative recovery is comfortable. You can feel some foreign body sensation, like you have something in the eye for the first 24 or 48 hours or so, but in general, people are comfortable with surgery. Another point to consider is the risk of having a complication is relatively low. There is no surgery that has 100% no complication rate. The risks of cataract surgery are well known. There are infection, the possible need for more surgery if we can't take out the whole cataract, the possibility of having a problem with the retina or getting a retinal detachment. And in general, the chance of any of those complications combined is less than 2%. Another thing to keep in mind is that even if you do have a complication with cataract surgery, it can often be treated quickly and expeditiously, and you can still have a good outcome. Another thing to keep in mind is cataract surgery is almost always an elective procedure. If you're not comfortable or not ready to do surgery at this point in time, it's okay to wait. Now, eventually, your symptoms will get worse and the vision will get worse, and it may get to the point where you can't drive anymore. So it is something you're going to have to do at some point. So it's important to realize and think about that, and also, but at the same time, not feel pressured into making a decision. And then the other thing is, make sure you're comfortable with the clinic where you're being seen and the surgeon that you're seeing. If you're not comfortable, it's okay to get another opinion. So these are some of the ways to think about cataract surgery and the anxiety around cataract surgery. It's the most commonly performed operation. In general, it's successful. In general, people don't feel pain with it. The odds are that most of us will do well with surgery. In thinking about this, I put together a little booklet here. It's called Clear Vision, a Patient's Guide to Modern Cataract Surgery. And I put this together with the goal of really providing patients with a little manual, a booklet to think about and go through and be well informed when they speak with their surgeon about cataract surgery. In this book, I laid out what a cataract is and what cataract surgery is exactly, and what the process is for cataract surgery. And also different types of lenses, how to choose a surgeon for cataract surgery, what happens on the day of surgery, and how the recovery is. I also talked about frequently asked questions. I'll post a link to this book. You can download the ebook today, and hopefully this will be helpful for you and allow you to have a more informed discussion when you meet your surgeon. Thank you. I hope this was useful to you.